Hi, welcome to the CVMA Island Pulse, the Cape Verdean Health Dialogue podcast. Today, I have the pleasure to introduce you to Dr. Pina. Dr. Pina, would you like to say a little bit about yourself?
Yeah, sure. So originally, I was born in Fogo and immigrated to the United States when I was 8 and lived in the area of Boston. But went through schooling and then medical school, and then decided to practice as a pediatrician. Been working as a pediatrician for over 20 years and currently am at Hasbro Children's Hospital in Providence, Rhode Island, and I serve as the Director of General Pediatrics at Brown University Health.
That's great. Welcome.
Thank you.
So, today we're going to be talking about toxic stress.
Yes.
And what I've learned is that babies do experience stress.
Yeah.
The fetus can experience stress, and that it does affect someone into adulthood.
Completely. And it's one of the areas I'm very passionate about because there's stuff that we could do to help our children that are stressed. So if you think about stress, stress can be a normal response to anything that is happening. That might be threat. So things that could be stressful, for us might be taking an exam. And for kids, it's first day of school or even getting shots in the clinic. But a lot of that stress is what we call positive or tolerable stress because there's somebody there to an adult that can guide and comfort the child. And so when they get stressed, but they're immediately calmed because they have a caregiver there to help them. But stress becomes toxic when there's a prolonged exposure to repeated negative events in our kids' lives. And, and these could be anything from abuse to neglect. But there is nobody there to calm them, reassure them, and really try to decrease the stress that they might be encountering. So infants can go through this early childhood, just like in adults as well.
Great. Yeah, no, I was able to understand a little bit from our
Yeah.
conversation
Yeah.
that this is something that can be prevented,
Yeah.
which is why, we want our Cape Verdean people in the diaspora or anyone who wants to learn about toxic stress in infancy and early childhood to
Yeah.
listen to our podcast. And we're going to definitely look into what we can do and what are some of the
Yeah.
factors, but also some of the things that a mom who's pregnant and
Yeah.
anyone can do to try to do some things to prevent toxic
Yeah.
stress.
Exactly.
So, what are common factors in our
Well,
homes and or in our communities?
yeah. Before we get that, I just wanted to tell you that really explain to people that stress, there's physical things that happen in our bodies that can lead to the negative consequences. So so when we are constantly stressed, our one of the hormones in our bodies that gets elevated a lot is called cortisol. And that can actually, for kids, because in the first 3 years of life, their brain is developing, they're making connections. But when these children are undergoing toxic stress, it does make changes to the brain, especially in areas that affect learning, memory, emotional control. And so it's not just the stress itself, it's the fact that the byproducts of that stress, the cortisol, actually affects the brains of our children.
Yes, I know that so what are some of these factors, whether it be, prenatal or in a home or in our community
Yeah.
that would be considered toxic stress that would
Yeah.
affect the brain development of the baby?
Yeah, so things that can lead to this includes any traumatic event. Traumatic event things that we worry about are violence at home, domestic violence, child abuse, which could emotional or physical child abuse. Um, and just re also being families that are stressed about finances. One of the biggest contributors to toxic stress is poverty, because that family is constant stress, looking for housing, looking for all stressed about where the next meal is coming out, and all of that is not only sensed by the caregivers and the parents, but also the children as well.
Yes. So how would we be able to see, like, are there any signs or symptoms or behaviors that we would be able to see that an infant is experiencing toxic stress?
Yeah. So before we go into like some of the signs symptoms, just I want to really make sure people understand just because your children might have these things, it doesn't mean it's necessarily toxic stress. It's always important to talk to their primary care provider to look at this. But in different age groups, it can come out in different ways. So for babies, it could be problems feeding, problems with sleep. Um, and also, it could affect their development. They could, have difficulties starting to talk, starting to walk, and or maybe they even startled all the time. They're always jumpy and jittery. And for older kids, it can, especially in kids in school, it can look like, they might have problems with hyperactivity, not paying attention, and also not being able to control their emotions. Something might happen at school and they blow up. And those are some of the signs that we look for. And in older kids, teenagers, they can present with anxiety, depression. All of these things are consequences of toxic stress.
Yes, yes. And I'm sure, families that are coming to America, immigrants and just even I would think, does it sound to me, it sounds to me that this could happen in any family,
Yeah.
right? Whether it be a family experiencing poverty or a family that might be more
Yeah.
socioeconomically stable.
Yeah. So traumatic events happen across the board. It doesn't matter whether you're rich or poor, but it happens across the board. So it's important to realize that they are more at risk when, families are in under-resourced areas, communities, because the community stress adds to that level, but it can happen to anyone.
Yeah, and so a woman who is pregnant and now is experiencing some of these stress
Yeah.
um, factors, there it's good. That's why we're doing these
Yeah.
podcasts, to educate people and to just make everyone aware that let's start right from the beginning. So you're
Mhm.
pregnant and you're carrying this child. If you're experiencing stress, the baby is experiencing stress. So if you're dealing with some domestic violence or experiencing stress due to not being able to feed your children or
Mhm.
keep your household stable and
Yeah,
calm, it's going to affect the baby as well.
exactly.
So that was something that I was going to ask you about. What are some common things that are that could be happening in the family right from when the mom is pregnant until that child is born and now into the community and going to school, that maybe just things that they can look for. And I know you've
Yeah,
definitely pointed some of them. Is there
yeah,
anything else that parents or families that are bringing an infant into this world
yeah.
can kind of keep an eye out and look for as potential stress provoking?
Yeah. Definitely. I think another very important thing that we need to stress is maternal mental health. The mental health of the mother is very, very important for all of this. And so this is something that the whole family, the community, we talk about. It takes a village to raise kids and families. It really does in this instance because, the mom can be stressed, the mom could be depressed. But it's up to, other people in the family, caregivers, grandparents to really help that mom, and also be more involved in the care for that child. Because it's especially for depressed mom, it's hard to build an attachment with the child. And so one of the treatments for toxic stress is nurturing environment and providing love and care to that child. And so if the parent is not doing well, whether it's depression or substance use, that's another big issue that can affect the parent-child relationship. And so these are all things that I think the whole family and and communities should be paying attention to and making sure that the caregiver for that child is both physically and emotionally healthy.
Yes, thank you. So, what are some strategies other than what you've mentioned
Yeah,
from a social emotional perspective that a mom or someone who's pregnant or a caretaker
yeah,
can do to? I actually have one, and
yeah,
which does include the family. Something that I think that's common in a household. If it's a big family,
yeah,
it can be very loud,
yeah,
so a lot of the television going
yeah,
on, people talking in the kitchen, and if there are arguments, right,
yeah,
or things that the family is struggling with, I
yeah,
thought of that. That one strategy is, and I like how you mentioned the whole family,
yeah,
right, to support the parent or the woman who's pregnant or the mother.
yeah,
One idea is, okay, just leave the room or suggest that she go into the bedroom
yeah,
or be more mindful of the noise level or what's
yes,
going on in the home, because
yeah,
that infant can hear it, that infant can pick up on that. But we definitely would like to hear from you. What are some strategies that a mom or
yeah,
family members can do to try to prevent the
yeah,
stress?
yeah. So part of it is taking care of themselves, making sure they have proper diet, uh, proper sleep, and even find ways when they are stressed or because stress happens to all of us. And there's periods where we're, scratching our head on what to do, and we've got to find ways to decrease that stress. And I think all caregivers, I'm a big believer in mindful practice, where you're in quiet spaces doing your breathing exercises to really decrease the stress hormones, the effects of these stress hormones. But other things in the families, I think it's important, and from our end, taking care of that child when they come to visit us for care. Important things that we make sure is that the family has the resources that they need. They're not stressed, that they have food, that the bills are being paid, all of these things that we call social drivers of health. And if anybody needs help with that, we're one of the many organizations that can help the family that way. So it's just, provide the material things that can help decrease the stress, making sure that the caregiver is taking care of themselves as well. And then also I think one of the most important things that needs to happen, especially in the first year of life, is the bond between the child and the caregiver. And this includes, sitting down with the child and reading to them. Okay. Not only does that build sort of the relationship and the bonding, but it also helps with their language development and helps calm them down, develop routines, you know, sort of like bedtime, take a bath, maybe provide a meal. There's a lot of studies that on, especially in the neonatal ICU, massaging that infant actually helps decrease some of that stress. So there's a lot of stuff that can be done without costing a lot. Really, what they need is love and care. And that helps decrease the stress, which happens to everybody. But as long as there's a caregiver that's really providing that really support and that care, the nurturing care, it goes a long way to decrease some of the stress hormones in the infant's body.
Yes, thank you. So here at CVMA, we volunteer our time to be able to give back to our community, both in the Cape Verde Islands, here in America, and now through this podcast, it's
Yeah,
going to be a global effort to reach out to our Cape Verdean people in the diaspora. Um, how do you see the information that we're giving and this topic on toxic stress and what you've shared? How do you see this information benefiting our people?
yeah. Um, I think it's extremely important. Um, Especially because this is sort of like this trauma, this stress gets passed down generation after generation. And a lot of times we blame the people for their circumstance, and especially when it comes to the stigma of mental health. Um, Sometimes our community doesn't believe all of these things, and it's, what reason do you have to be depressed? No, these are things that have happened to us, the trauma that has happened to all of us that contributes to these negative mental health outcomes. And we really need, as a population, if we want our people to be healthy, to do well in school, to succeed, to further our communities, we need to pay attention to the negative effects of stress. And we need to destigmatize it. And we need to be supportive of each other's. And so, we have extended families, aunts, uncles, all of that. Everybody has a role in sort of helping families and our children grow in healthy environments. And I think also we have to be careful how we discipline our kids. Yelling all the time, hitting, definitely all of these things contribute to the trauma that affects our kids. And so we need to look at alternative ways to discipline, and realize it's not easy. And sometimes parents have to take a break. They have to walk away from certain situations where they might do something that'll negatively affect, walk away, take deep breaths, calm down, and come and have a discussion on whatever behavior that you are trying to correct in that child. But hitting them, yelling at them does not work. And it also contributes to all of this toxic stress. And then the fear that our kids have of being hit, that stays with them for a long time. And all of this affects adult care. It can lead to all of these sort of, we call them adverse childhood experiences. Um, and the more you have, the more likely as an adult you're to be unhealthy, using substances, heart disease, diabetes, all of these things can be traced back to the childhood experiences that our community faces.
Would you say that toxic stress can lead to, I hear you saying that they all contribute. I'm almost thinking of almost like a cycle,
Yeah,
that if the infant
yeah,
is, so if the fetus is experiencing stress because the mom is experiencing stress, and then the infant experiences stress because the mom is in a stressful environment or dealing with stressful type of experiences, and then it's a toxic environment that
yeah,
then contributes to some of this trauma that leads, because we
and
started the podcast with saying
yeah,
it leads into adulthood. Is that
yes.
kind of how you
Yeah,
see
and
it?
it's lifelong. And the other thing we didn't really discuss, but there are also changes that happens to our genes because of the chronic toxic stress that gets passed down generation after generation. And so and this can lead to how people respond to stressful environments. So, I bump into you, you know, most people will be like, it's okay, blah, blah, blah. But some people just immediately lash out. And that's a trauma response. That's a trauma response. And so our goal is to break that cycle, and let's start addressing it so future generations don't have to be going through this.
Yes, I agree. And I'm so grateful that you were able to take the time
Yeah,
to have this discussion with
yeah,
us so that we can put it out there.
yeah,
I'd like to add that
yeah.
one of the benefits of having this conversation is so that we can start to change some of that generational
Mhm.
trauma, and be a people who, we're already poderosos, right?
Exactly.
We're smart, where we love life and
Yeah,
we love to enjoy life, but let's make sure that in our home, and right from infancy, where we're starting to break that cycle, and learning about toxic stress, I'm sure is
yeah,
going to be great for our people to learn through this podcast and through our conversation. um, I'd like to thank you
yeah.
for your time, and is there anything else you'd like to say?
I'm trying to think. I mean, the other thing I really wanna emphasize is that um, there's a lot of things that can be done, not just at the family level, but also at the community level. We need safe environments in our communities because that contributes to the stress. We need good schools for our children because those that are, had consequences of toxic stress tend to not do well in school. So schools need to recognize that and provide more support. All of these things can be prevented. And obviously, there's a lot of policy things that needs to happen. Um, we need to, have paid family leave for parents. That way they can stay home with their children. And we need more government support with tax credit to decrease childhood poverty. We did do it, decrease childhood poverty by half immediately after COVID because they did a lot of tax credits and gave extra payments to families, but then they took it away and child poverty rate has doubled again. It's amoral the way this is. So there's it's more than just an individual, but there's also needs to be a lot of policy that can help decrease the family stress. So there's a lot that we can do, and we need to start advocating for it.
Thank you. Obrigado.
Yeah, de
And thank
nada.
you. Thank you, everyone. We hope you found this conversation helpful. Our next episode will be with Dr. Maritza Barros, and she has a panel of very great professionals, and they're going to be talking about removing the stigma, which Dr. Pina did mention in our conversation. And so just remember, toxic stress is a very important subject and something to keep in mind and be aware of. Taking care of yourself, taking care of your family, using mindful practices, creating quiet spaces, and definitely looking into resources, whether it be within your family or in the community or different resources for food and financial stability. And this topic was on infancy and early childhood and how toxic stress can affect children into adulthood. So just remember, Dr. Pina mentioned that most importantly, supporting the caregiver, the mother, bonding with that child and providing that opportunity for them to read a book and, just massaging the baby, infant care, and seeing how we can stop that cycle of toxic stress and trauma in our community.
Yeah.
So again, thank you. We hope you enjoyed our conversation.
Yes, I did. Thank you for the platform to discuss this.
Yes, it was great. It was great getting to know you. And now we are officially recording it. And I do hope that everyone benefits from this conversation.
Okay.
Thank you, everyone.